All righty. So, thank you everyone for joining us today. As I mentioned earlier, this event is going to be recorded, but I want to start off by introducing you to our guest today. So, we have Karen Schroeder from the Tarrant Area Food Bank. She is the manager of healthcare partnerships and will be facilitating the first part of today's events. She's going to present on navigating conversations around food insecurity as well as food benefits. And then after the presentation, Jeremy Joseph, the director of the Student Assistance Resource Center here at the HSC, is going to join her, and they're going to answer some of the questions that we received beforehand, as well as answer any questions that the audience members may have. So at this time, I'm going to go ahead and pass it off to Karen.
Hi there. Good morning. I really appreciate you inviting me to come speak with your group today on this very important and crucial topic of food insecurity in our community, which has become more and more prevalent over the last few years. And so I'm with the Tarrant Area Food Bank. I've been with the company since last April. Like you said, I'm healthcare partnerships manager. So my main responsibilities are developing relationships with hospitals, clinics, medical schools, to talk about food insecurity and how to screen for food insecurity, and then what to do in the case that there is food insecurity that your patients or your community are being faced with. So I'm going to share that with y'all today. And like I said, I'm just so pleased to be able to talk with you in your group. I will go ahead and stop my video. Okay. So today we're going to talk about, we're going to take the time to talk about Tarrant Area Food Bank and its place in this community, and how Tarrant Area Food Bank services so many people. And we're also, I'm going to define food insecurity and food security, and then talk about the impact of food insecurity on health. Then moving on to identifying patients with food insecurity. And then, of course, community resources. That's the, what do you do? What do you do when you know someone is food insecure? And then we're going to talk about students that are experiencing food insecurity, the effects, and also resources. So Tarrant Area Food Bank, the service area covers 13 North Texas counties. So it started 40 years. I think we just celebrated our 40th anniversary. It started out just in Tarrant County, and as you can see, it grew. It stretched west, north, and south. So the line is kind of the east of Tarrant and east of Denton is actually North Texas Food Bank, and that is more headquartered like in the Dallas area. And they also have a wide county areas that they cover. So Tarrant Area Food Bank, if you fall in these areas, Tarrant Area Food Bank is the food bank that is covering those areas. Denton is actually split in half. Half of it is the North Texas Food Bank, and half of it is Tarrant Area Food Bank. So we kind of split that area. There's 343 partner agencies that Tarrant Area Food Bank works with. And so what that means is it could be hospitals, community centers, churches, schools that can be considered partner agencies. UNT Health Science Center is a partner agency, just to give an example. Our mission is to empower communities to eliminate hunger by providing food, education, and resources through innovation and collaboration. I know when you think of the Tarrant Area Food Bank, you think of course, food, but education is also an important part of our programming and what we do. And that actually falls in part of my healthcare partnerships department is we also provide education on cooking and healthy living, wellness. We do classes for the community as well. So that is kind of the basic food bank information. So this page I always like because it kind of summarizes where we are. We're feeding about 60 million meals in a year. And that number I think is going to probably go up. And per week we feed 1 million meals possible through the Tarrant Area Food Bank. But we believe that access to healthy foods is a basic human right and not a privilege. All people deserve regular, nutritious meals. That's part of our value statement, and we really live by that. We have nutrition policies that we don't accept or we don't keep like sodas and foods that don't meet criteria as a nutritious meal for our community. Have gardens that are affiliated with the Tarrant Area Food Bank. Last year we had 3,120 pounds of fresh produce that we grew in our gardens through our partner agencies and also our gardens that Tarrant Area Food Bank has. So this is just kind of a summary of Tarrant Area Food Bank's servicing that we've done. So what is food insecurity? Food insecurity is defined by the USDA as limited or uncertain availability of nutritionally adequate and safe foods, or limited or uncertain ability to acquire acceptable foods in socially acceptable ways. Food security is defined as having access to enough food for an active, healthy life. And then we often talk about hunger as part of a food insecurity, and hunger is actually defined as a situation where a household members unwillingly go without food for an intermittent period of time. So it's actually a potential consequence of food insecurity. So when we talk about hunger, so that food insecurity can be one of two things. It can be episodic, or it can be seasonal or cyclical. So episodic would be like if you had an emergency expense, like you had a medical bill or a car repair, or there was a natural disaster, that would be considered episodic food insecurity. It could also be seasonal or cyclical, like in the summer, children lose access to school meal programs. Or in the college setting, you could say like in between semesters, whenever you're not on campus, you're not getting some of the food benefits that you might have, like your meal plans that are available. That would be a seasonal or a cyclical food insecurity. So populations that are more likely to suffer from food insecurity are those with incomes near or below the federal poverty line. Also, households with children, particularly those headed by single women or single men, are more likely to suffer from food insecurity. Women and men living alone are more likely to suffer or experience food insecurity. A lot of that, of course, would be, a lot of times that's going to be your college students that are living alone. Also, Black and Hispanic headed households in rural areas are seeing deeper struggles with food insecurity as compared to like more urban areas. Also, older adults are likely to experience food insecurity. So I'm going to play this great video. It's called Illuminating Intersections, Hunger and Health. It's 3 minutes, and it focuses more on the health effects of food insecurity, effects on your health, effects on a patient's health. So I'm going to play this video, and then I'll pop back in with you.
What if you had to make the choice between meals and medicine? Between making rent and filling lunch boxes? What if you didn't have enough money to keep the power on at home and nourish a healthy body? 37 million Americans, that's 1 in 9, are food insecure. This means they lack consistent access to enough nutritious food for an active, healthy life. Our neighbors who are food insecure cannot always stretch their household budgets to meet their basic needs. Even with the support of federal nutrition programs or help from family, friends, and community organizations, food insecurity can have serious long-term effects on a person's health. Healthy bodies and minds at every age require nutritious meals. When people don't have enough food, when they consistently need to choose inexpensive, low-quality calories, or experience chronic stress about where they will get their next meal, their health can suffer. People who experience food insecurity are at higher risk for diet-related diseases, such as type 2 diabetes, high blood pressure, heart disease, and obesity. More than half of households served by the Feeding America nationwide network of food banks have at least one member with high blood pressure. 1/3 have at least one member with diabetes. When an individual or family cannot afford enough nutritious food, they sometimes adopt coping strategies and trade-offs that work in the short term to avoid hunger. However, over time, these can increase the risk for diet-related disease and make it more challenging to manage. This reality can lead to a cycle of poor health. The cycle begins when an individual or family cannot afford enough nutritious food. The combination of financial stress and inadequate nutrition can result in poor disease management. The time and money needed to respond to these worsening health crises further drains the household budget, leaving little money for essential nutrition and medical care. This causes the cycle to continue. Food insecurity also negatively impacts the lives of future generations. In the United States today, more than 11 million children lack regular access to nutritious food. Children at risk of hunger are more likely to be in poor health and struggle in school. For some, it may have negative lifelong implications that could prevent a developing child from reaching their full potential. Together, we can make real change. We can break the cycle and build healthy, strong communities. Join the Feeding America nationwide network of food banks as we work to ensure all Americans have access to the nutritious foods we need to thrive. Take action, advocate, volunteer, donate. Visit hungerandhealth.org to learn how you can make a difference today. Together, we can end hunger.
All right. So that video, there's more slides that kind of reiterate what that video was talking about, just the health repercussions of food insecurity and how much of an impact it plays on health. So looking at it as from a health provider outlook or view, you think why screen for food insecurity? And it's really important because low-income patients who experience health problems related to poor diet quality and inactivity often have resource-related barriers that prevent them from achieving desired healthcare goals. So a lot of times, if you don't know this is a basic problem, then a lot of the treatment and advice you're giving as a healthcare professional, it's not going to be real effective because of the barrier. So how does food insecurity impact health status? Food insecure individuals often have difficulty accessing a healthy diet in line with the dietary guidelines for Americans or MyPlate. Many will choose like low cost, high highly filling foods that are less nutritious in order to stretch the monthly budget. So you're going to see that the variety won't be there. The variety of foods and nutrients won't be there because they're really narrowed on their what they're choosing, just because it might be cheaper food that they're needing. Also, people will skip meals so that they can afford their prescriptions or their medical care. Of course, if you're skipping meals and you're on medications that require food to take with it, that's going to have another health risk. A lot of times we'll see that also that people skip meals so that others in the household can eat. And we often see that with mothers. They'll go without so that the kids can eat. The combination of an unhealthy diet and food insecurity negatively affects physical, mental, and social health and increases healthcare cost. And that was talked about in the video as well. A correlation between food insecurity and poor health status has been demonstrated in numerous studies. There's developmental risks and decreased health status in children. And that's, of course, the groundwork of, which the rest of their lives are built. So that's why it's important, a food insecure child is really missing out on a lot of the nutrients and behaviors that a food secure child gets. More health status issues with older adults would be lower cognitive function, gum disease, diabetes, hypertension, obesity. These are all things that food insecure patients often can experience. I talked about, part of the trade-off of medication or food. A lot of times there's medication non-adherence because they're not able to afford the medication because of they're choosing food, or they're not able to take the medication because it might make them sick if they take it without food, or like insulin, those type of things, so non-adherence is pretty common in this population. Depression, there's a higher probability of depression, higher rate of iron deficiency anemia, and more hospitalizations and longer inpatient stays. So some of the chronic conditions that can be elevated with someone that's food insecure, 50% more likely to be diabetic, high blood pressure, have higher blood pressure, higher rates of congestive heart failure, and asthma. There was a study that showed it was 3 times higher prevalence of depression in food insecure population, and a diminished capacity to maintain independence while aging. So given these correlations, it's not surprising that patients who were food insecure have higher health costs. A 2017 study showed that average healthcare cost difference between food insecure and food secure individuals was about $1,800, and it was greater for individuals with diabetes. You can see on this chart here, it's about $4,400 difference between a food insecure and a food insecure person with diabetes. And then heart disease is $5,100 difference. So that is pretty significant. So how do we as healthcare professionals identify, or how do we address, what do we do to know if someone is food insecure and if it's affecting their health status? there's 5 different steps you can take. The first one is to identify a patient living in a food insecure household, which I'm gonna talk to you about that in a few slides later. Connect the patient with a proper resources. Consider the clinical needs that result from food insecurity. Like we talked about the diabetes treatments and other meds that might affect their meds that might be affected by poor intake. And there might be certain labs you might need to run because their patient is food insecure. You'll want to follow up with the patients at their next office visit, and then continue to measure the impact of food insecurity intervention on the patient's food insecurity status and health. So we'll go more into those. So you're going to want to identify patients living in food insecure households by screening them. And if they're positive, then the healthcare provider will care for the patient by listening and learning more about their needs and their wishes. So these are 3 different food insecurity screening tools that have been validated. I'm just going to tell you now that the one on the far right, the 2-item hunger vital sign, is the one that's kind of the gold standard now. So just because the sensitivity and specificity is the highest. So that's the one that most healthcare institutions are using. It's the 2-item hunger vital sign. So sorry, we'll go to the next one. Okay, so this is the screen for the food insecurity using the hunger vital signs 2 questions. So you're going to ask, these are the 2 questions that you can ask your patients. And if the answer is often true or sometimes true to one or both of the questions, then they're actually considered positive for food insecurity. And so in that case, then you would need to offer, or you would want to offer resources for them. So the first question is, within the past 12 months, we worried whether our food would run out before we got money to buy more. And then they would answer, was that often true, sometimes true, or never true for your household? The second question is, within the past 12 months, food we bought just didn't last and we didn't have money to get more. And they would answer, often true, sometimes true, or never true for your household. So screening generally takes a minute or less, and it shouldn't be done more than like every 30 days. You want to screen all adults at least once, and then those at high risk annually. You want to when you ask these questions, you want to do it in a private way, of course, in a private setting and by someone in a trusted professional position, and avoid asking a parent or a caregiver in the presence of a child. That's often just to avoid that awkward or the discomfort with the child. You want to be sensitive and make sure the conversation's in a respectful and comfortable format for you and the patient. And you might even preface it by saying, I ask all my patients about access to nutritious food because it's such an important part of one's health. Or I'm seeing so many people who have had a hard time affording food, and many people need assistance at some point in their lives. So I'm asking all my patients about food access. So you can kind of preface these questions in a way that makes it a little bit less awkward. You want to make sure you're using the preferred language, of course, of the patient. And, if you're in a situation where you can have something around that might, like a poster or some sort of brochure that addresses food insecurity resources, that would be nice to have around too. And you want to acknowledge that it's difficulty discussing this and financial struggles, especially for caregivers. You could frame it food insecurity as a health problem, because I mean, just going over all the health ramifications, so you could kind of frame it in a health light, to destigmatize the issue of food insecurity. That's another angle you could take. So once you're aware that a patient is food insecure, there's other aspects that need to be addressed. And we talked about medications due to the trade-off of food versus meds, and adherence issues. Also mental health, because of the strong correlation between insecurity and depression, there might be mental health concerns that need to be addressed. And then, of course, health and nutrition education, and helping patients understand how to make better health and nutrition choices based on what is available to them. With the medications, talking about what to do if they're having to skip a meal, what to do, kind of working with what they have. Adjusting dosages. Making referrals to agencies that can help patients apply for prescription assistance programs or discount pharmacy programs could also be useful. And of course, you just want to follow. You want to follow up on visits. Make sure that they are getting what they got, the support they needed. And then you want to continue to screen. So, looking at labs, looking at the pharmacy data if the prescriptions are being filled. You just want to make sure the patients receive the resources and if their health outcomes have improved. So now the good stuff about what do you do? Like, what do you do? What do you tell a patient or someone out in the community that is food insecure about resources? So first of all, you could check if they have a health insurance plan. There's a number on the back of the card they can call and see what kind of benefits they might have, what kind of food benefits they might have. The federally assisted programs that are most common that most people have heard of is the SNAP, and that's going to be like a debit card that it's money to purchase food, and that's there's eligibility requirements for that, and a lot of people that are getting SNAP assistance now are going to actually, I think starting to March 1st, which is today, they're actually having a deduction in their monthly allowance because they had increased it with COVID. So you'll probably heard that on the news the last few days, is that those benefit is going to be less. So we're already assuming we're going to get more use of, people are going to be using the food bank and food pantries more often now. So there's also WIC, and that's money to purchase pre-specified foods for pregnant and postpartum women, infants, and children. School breakfast luncheon program for children, free and reduced price healthy meals for income eligible students of all ages. And then the summer meals program, of course, is kind of another program that for kids, and it's for during the summer for free healthy meals for students 18 and under. So it kind of works with the school breakfast and lunch program hand in hand there. There's senior farmers market nutrition program, which are vouchers for low income seniors to redeem at farmers markets, and community supported ag programs. Then the CSFP, that's the Commodity Supplemental Food Program. It's called, we call it our senior program. And that's something we do have here at Tarrant Area Food Bank. And it serves eligible low income seniors with a monthly food package. It's usually a shelf stable box of food that they get once a month. Elder care and area agencies on aging are services that help older adults remain in their homes. And for federal food referrals, there's a hunger hotline, and that is going to go to a center that will then share information on local food banks and other social services based on location. And then there's veterans service organizations that offer a range of services, including assistance with benefit claims and emergency food. So nonprofit food referrals. So Feeding America network of food banks. So Feeding America is like the umbrella of all the food banks, or not all, but a lot of the food banks. And Tarrant Area Food Bank is under Feeding America. So we're kind of in that network. So it's local resources for feeding programs in your community. So that would be Tarrant Area Food Bank, would be Feeding America Network Food Bank. Meals on Wheels is another it's a free or low cost home delivered meal for seniors. 211 Helpline Center is a social services for everyday needs and in times of crisis, including food support. So these are the two. So finding food websites for connecting patients to resources, or for yourself or someone in your community. There's the North Texas Food Bank that is, of course, east of Tarrant, and then north and south, northeast, north and southeast, and then the Tarrant Area Food Bank. So both of these websites have really great, it's a resources for, I call it finding food. And it's going to be like where your local pantries are, what different programming is offered, different ways to get in touch with the resource representatives to help get signed up for SNAP or for some of these other benefits. So these are the Tarrant Area Food Bank resources. And I'm going to give Lauren this page with the links so that y'all can take a look at that, or you can just go to their to the website and you'll find all these things on the website. But we have, if you go to the main page, it'll have the local food pantries, and you put in like your zip code and it'll pull up all the ones in your area, and then it'll tell you dates and times that the food pantries are accessible. And usually a food pantry, I guess I need to back up. So the Tarrant Area Food Bank we're like the distribution center, and then all the different pantries order food from Tarrant Area Food Bank, and then they get it they either go get it or they get it shipped. So you sometimes see the Tarrant Area Food Bank trucks kind of zooming around town. So they're delivering, or like I said, the pantry comes and picks up the food. So those local food pantries, there's kind of scattered throughout the areas. So you can find a local pantry or find one that based on whatever day or time you can get there based on your transportation needs. There's also a list of mobile pantries. That's where, we take a truck and it's scheduled to be at a certain location, and you can get your food there. And then there's mega mobile distribution events, and that we saw a lot of those during COVID. Not quite as many lately. Mega mobiles, those are the ones like at the stadium. So the senior box program I've already discussed. It's where the qualifying seniors, it's based on age and then other eligibility like income. And it's food just to help supplement their diet. And they get that, they sign up through the different pantries, and they can pick them up there at their local pantry. Then there's SNAP, and that's helps low income and those temporarily unemployed purchase nutritious foods. And we have community resource specialists that are amazing, and there's many ways to contact them. And that what they do is they help with applications for SNAP, TANF, WHT, Medicaid, and CHIP. WHT is Women's Health, and TANF is like an emergency nutrition. I'm blanking on what the T. Yeah, I'll get back to you. So as the healthcare part of Tarrant Area Food Bank, I work with hospitals and clinics, and so I help them. I tell them about how referrals work, where if you work in a healthcare setting and you have a patient that's food insecure, we have a referral program to help for our so they can get help with SNAP or other programs. And so that's been really great for like a direct referral line. So the healthcare team refers to someone to help them with over here to Tarrant Area Food Bank to help them enroll in SNAP. And it like within 5 days, we'll have one of our specialists reach out and help get that set up. We also have a home delivery program for healthcare that I work with the clinics to set up. And it's kind of like it's the food delivered within certain zip codes, and it's for homebound people. Other healthcare partnership programs we have, we do nutrition and cooking education, which has been Cooking Matters. Is we bring in all the cooking equipment and the nutrition materials. And we have a class of like 10 to 12 people, and we teach them how to cook and we teach them about nutrition. It's basic nutrition, but it's taught by a dietitian. So there's not disease specific, but that's a program that we offer to our healthcare partners. We also have produce and activity prescription program, and it's also called Parks. And that is another program that is led by a dietitian that dietitian moderates. And it's a group of about 10 to 12, and it's a cohort. And they talk about topics like nutrition, activity, stress, and sleep. And those are the topics. And it's a 8 to 12. You can pick how you want it laid out, but 8 to 12 sessions. And it's we bring produce every week, and the participants can shop from the produce that we bring. It's like 10 pounds a person. So that's another healthcare partnership program. Food insecurity screening training we do. We can look at sites. Our agency team can look at a site to see if they how to fit a pantry in. So if you are a member of a church or a community center and you're interested in setting up a pantry, we have a team that can evaluate for that. We also have the mobile red bus, and they don't really distribute large amounts of food from it, but it's mostly as a resource for our. It stands for Resource Education Delivered, and that's RED, and it has our resource specialists on it, and they help people sign up for SNAP and other applications that might be beneficial. So in the pipeline, we have medically tailored meals. So we also have a big kitchen, a big industrial kitchen here at the Tarrant Area Food Bank. And the plan is in 2025 to start making these medically tailored meals to deliver to the community. So it would be specialized and made here and delivered out. So that is kind of an innovative thing we're doing. It's in the planning stages. The groundwork is being laid. So we talked all about food insecurity in more of a clinical setting or more of a community setting, but I did want to talk about such an important thing. It's the food insecurity in college and post-secondary students. What I found was that post-secondary students, there wasn't a lot of research on food insecurity in that population. A lot of it was college, but like medical school, residency, all that, it wasn't really as much research on it. So but a lot of it can mirror college, those same statistics. I know it's not exactly the same, but I think the main thing is that it's a hidden epidemic. Like it's I almost, I read that the society is kind of normalized food insecurity in college students. And I thought that was really interesting because, it's um, something that is, I think people, I think administration knows, but it's like people in the community might not know as much about the struggles that students face in college with food security. Um, so a third of college students experience food insecurity pre-COVID, and then 3/5 experience post-COVID. Um, and so effects of food insecurity are evidenced inside and outside the classroom, and effects like being tired, hungry, unable to concentrate. You might do trade-offs with your food for fuel or rent or books or medicine. Also loan interest payments. Those are decisions that students are having to make. And so it does become a struggle. It's associated with poor nutrition and health outcomes. And as shown in the earlier presentation, the health outcomes of food insecurity are profound. There's higher stress and depression with those that are food insecure. And it's shown to have adverse academic outcomes and adverse productivity. And just to remind you, to remind you of the definition of food security again, it's defined as having access to enough food for an active, healthy life. So that's just a little reminder what. Did I go back too far? Sorry, guys. So some of the barriers to getting food, of course, financial. That's a big one, especially at the end of the month. You might have, health professional students have limited resources because they're in school. They might not get to work as many hours for wage. But that's not just financial, it's also time. And when medical students are spending much of their time on their studies and their clinicals, they might not have enough time to go grocery shopping. And so they might resort to cheap, unhealthy fast food or even skipping the meals. There's a study in 2019, and that showed that food insecurity was often happened because in addition to not being able to afford food, students said that had the inability to get a grocery store that met their needs. But whether, so it's the access. So it's the grocery store might not be within, walking distance or on the bus line. They don't have a car. And also access being, some don't know how to cook. That's another access situation. Not knowing how to cook with your limited equipment or limited foods. So you'll often hear the term food deserts, and that is when you live or work where there is no grocery store within a mile of your location. And so a lot of times that can contribute to that access issue, is being in a food desert. This is a slide of theme. These are themes of suggested solutions to address post-secondary food insecurity by socio-ecological construct. So it was I wanted to just share this because I thought a lot of these things a lot of campuses do. I know that your campus is doing some of them, but for those of you who want to, innovative, thinkers. I think these are just a good list of um, examples of things you can do to help alleviate the food insecurity on campus. Um, there's, food and financial literacy education programs or vouchers for meals, peer-to-peer mentoring, um, student, staff, and faculty donating meal plans, or financial support to students in need. I thought this one was interesting. Apps, which I don't have any experience with this as a design for battling food insecurity, but allows students in need of a meal to connect with another student who has excess meals. Let's see, campus food pantries, which y'all, UNT Health Science has food pantries, which I'll talk about in a minute. Increased employment opportunities on campus, altering the cost of meal plans, community gardens, which that's another check mark for UNT Health Science. Y'all have a community garden. Network stakeholders, increased healthy retailers in and around campus. I know that's tough. That's tough when you're in an urban area. And then policy changes. So there are some restrictions with eligibility for SNAP for college students. And that's one thing that it'd be great if you are interested in having SNAP as a student. We do have our resource team can help figure out if you'd be eligible for that. Enact laws to increase student access to healthy foods, increase financial aid, or create basic living stipend for students. So I do know that you have 2 food pantries at UNT Health Science. I wanted to highlight them, and those are y'all are Health Science Center is partner agency with us, so they're ordering food from our distribution center. Any current Health Science Center student in need can visit the food pantry. I want to emphasize that because if you're in need, you can come. It doesn't require an application or any approval, and it's available to any student in need. But I think the only thing is you have to weigh and record what you take. So just so they can keep up. So the Office of Student and Academic Affairs has protocols that allow for confidentiality and dignity to be maintained and respected. And I think that is essential. So you can also, if you visit the food pantry, you can also talk with a staff member to talk about any difficulties that you're facing. And there's details on that about checking in on the second floor of the Student Service Center and ask to talk to the care team. You can make an appointment with a care team. And then a referral can be made for community resources. But the 2 locations are the library room 450, and that is open all the time, 24/7. And then the Student Service Center room 180 is Monday through Friday, 8 to 5. So I think that's amazing that you have that there's a 24/7 there. That's so great because hunger happens around the clock. So the food pantry, this is actually I did this for donation, kind of just so you could see what was there or what they needed. Is kind of, I liked this because if you had the desire to donate, these are some of the items that they need. And so you can just take a look at that. It's the hours again, weigh what you take, nothing expired. And of course, the Office of Care and Civility is, there's a link to them too on there. This was the flyer. It's actually online for the Health Science Center too. This is more information about dates and times and items that are offered there, and then donations. So sorry, that was kind of redundant. I just realized that. This I also sent to Laura to distribute, and this is the food bank, Tarrant Area Food Bank food resources. This one on the upper left, the local food pantries. These are all going to be online, so you can find them there too. The local food pantry, put in your address, and the ones that are local or nearby will pop up. Home delivery program for people with disabilities, senior box program, and then SNAP. And what's new is if you see where it says, or I have the phone number to contact our community resource specialist, which, by the way, will be on campus this evening for the evening session, the in person. They will be there and they will be helping with applications. Or you can click here to schedule an appointment. I'm going to click on it and show you. So this, if you were interested in meeting with a resource specialist, these are, you could do a virtual meeting. And so there's going to be a calendar, and you can actually make an appointment, and they will get in touch with you, and you can go over the application with them. So there's a few locations. I think one's in Keller and one's in Grapevine. I think, yeah, in Decatur. But there's virtual, or there's on the phone. What am I saying there? Oh, over the phone or virtual. Or they're coming this afternoon. Or you can call, I'm afraid let's see. Or you can call the number, this number, 1-866-430-6143. All right. This is also on our website. It's called the Go Healthy Recipe Library. And you can put in, it has hundreds of recipes. And if you get some items, maybe you got a bag of sweet potatoes and you don't know what to do with them, or you want to do something different with them, you can put that in there. It's a lot of the foods that we distribute. And so you can use that library to help you cook and get some variety with some of those foods that you get. So check that out. And we're nearing the end. So Tarrant Area Food Bank also has the gardening program, and they're I did a little summary here of the benefits of having gardens in the community, saving, increasing food security, increasing vegetable intake and physical activity, saving money on food bills, making beneficial use of vacant or unproductive spaces. We have one right outside of our office here. It's called the Kindred Spirits Kitchen Garden, and it's in the parking lot. And so we have produce growing in our parking lot. It's great. The Learning Garden on Sappington Place is kind of closer on the off of Camp Bowie, west side of town. And the Learning Garden's great. There's different examples of how to garden with limited space and limited equipment. It's great. And if you even for volunteering, if you're interested, it's a really special place. And there's also, they compost there. So that's an education opportunity as well to learn about composting. Foster community with gardens and reconnect people with nature. And that's so great, especially for college and med students. I really would suggest trying to connect like that in a garden. It's great. So there's the map. There is a map you can click on. This is on our website. So there's a map of the community gardens. There's many. There's probably 100. These three here are the ones that we operate alone. The others are out of church or that we kind of helped get them set up. They're at churches or garden or community centers or schools. There's also one in the West Garden in Parker County. So you, as UNT Health Science Center, has one of our partner gardens. It's the community garden on your campus. So you'll have to check that out if you haven't. And one more program that's worth mentioning is our farmers market nutrition program. We offer, I guess, WIC has vouchers. They take you get and you take to the farmers markets, and you get like bonus. You can spend a little more because you're at a farmers market. It's like 2 for 1, I think. And that's May 6th through September 30th. You can shop there with a WIC voucher and also SNAP vouchers. So that, of course, is on the horizon, and we got a couple months. But we also do education programming out there at the farmers market. It's over off of Clifford Street. It just moved in the fall. It was on the traffic circle, and now it's kind of west near White Settlement. So farmers markets, that is another place that you can, that the food bank, the Tarrant Area Food Bank, is often present. This is my last slide, and I just wanted to, talk, Tarrant Area Food Bank's always taking donations. A lot of our food is donated from groceries. A lot of it we do purchase, but we do rely on food from some of our big grocery stores we have partnerships with. We also take donations, monetary donations, and donations of time, volunteering. If you check out our website, we have opportunities to volunteer at, helping teach a class, or working in the warehouse, or working in the gardens. So many opportunities. So I really, would suggest, if you're looking for a volunteer, if you see that in your heart, to think of us when you have a little. I know you don't have a lot of extra time, but if you're looking to do that, then think of us. And I am going to share the resources with Lauren, and I hope that you reach out to her and to our resource specialists that are out, or make an appointment. They'll help walk you through the application and then answer eligibility questions. They're such a treasure to us. So I appreciate your time, and I'm over here at the Tarrant Area Food Bank, and please reach out if you need anything.
All right. Well, good afternoon, everyone. I want to say thank you so much to Karen for taking the time today to share your experience and all of the great programming and community work that Tarrant Area Food Bank is doing in the community. I do want to remind everybody that is participating, if you do have a question, please use the chat or the Q&A button at the bottom. I'm not sure if your mics are working. Your mic does not work if you try to unmute. So if you do have a question, please put that in the chat. And for the sake of time, if we can try to get to one of those. If we don't have time, we will get to that and provide you an answer later. So with the time that we do have, Karen, I do want to ask you a question here, since we do have you here. One question I think would be important for our participants is, you spoke a lot about defining food insecurity. You spoke a lot about the programming and some of the ways that individuals can get involved, and some of the resources that we could utilize. But I would like to know, and I'm sure our participants would like to know from your experience, what are some of the creative ways to work around food insecurity, especially with the fact that our student population is high in food insecurity. Just want to know what your experience is with creative ways to work around that.
I think being that it is a community atmosphere, I think sharing resources, if someone, if you could kind of do a co-op type thing with your peers, or your community. Like if, someone gets a 10-pound bag of sweet potato or 20-pound bag of sweet potatoes, kind of do a kind of a swap, a food swap, just to kind of get some variety, because that's important. You don't want to just focus on one food. Other ways, that's a really good question. I'm thinking. I was talking to one of my teammates about he'd heard of it's like a swipe card. Like, do you have meal plans there? Like, do you have a cafeteria?
We do not have meal plans, but we do have cafeterias on campus. We have 2 different locations of cafeterias.
What he said, I think TWU might do it. It's like a swipe it forward. And that's if you have meal plans, though, where if you didn't use your meal plan, then you could donate it to somebody. I don't know how that would work in your setting, though. I do know that a lot of times the end of the month is when it really gets harder. So just trying to kind of think about that and how the end of the month, trying to plan around that. But yeah, the gardens, of course, are good. I don't know how fruitful the garden is at the school. How much is produced there. But yeah, there's, that's a really good question. I need my team to like be here to say, oh, and that, and that, and that. Just, using the recipe library on our website, I think is a good way too, to kind of get off the being mundane, trying out, when you kind of have the same types of foods often, and using the recipe finder to help be a little more creative.
Okay. Yeah. Thank you so much. We do have one question from the audience that I do want to ask. This is an anonymous question, but the question is, do you have any tips for initiating a conversation with someone that I fear might not have food security?
Yeah. So if you feel like someone, just trying to make it so that it's this, so that there's not a stigma. So, talking about, about how a lot of people, it's, the times there's more struggling in the world right now, and that many people that never thought they would have to get assistance are having to, kind of stretch out a little bit and use some of the resources out there. I know a lot of times people avoid reaching out because they feel like, they think, I don't need it as much as somebody else needs it. And so a lot of times people won't, because they have in their mind, like, oh, I don't want to take it away from somebody else. But encouraging them that, this is your time when you need a little bit of help, and that's okay. And that's what this is for. That's what these programs are for. And it may just be, at the last few days of the month, like it's what it's for. And many people struggle, and people that you don't think would be faced with it happens. And there shouldn't be shame in it. And nobody at a pantry feels that, like working at a pantry feels that way. They just want to help. Um, Tarrant Area Food Bank just wants to help. And that's why we had, like I told you, our resource team that helps with applications for some of these programs. They're so amazing. Like they just want to help you. So it's a good place to be. Like on this side of being able to help. And it just might be temporary, and someday they can help someone that's utilizing our service can pass it along at some point and help someone else out. So just framing it in a way that makes it so it's not shameful, because there's no need for that.
Yeah, awesome. Thank you for your response. I would just add to that. I think that just keeping in mind the humanistic approach, like thinking about putting yourself in their shoes. How would you want that conversation to be approached? Because there is a stigma still around it, around food insecurity. So I think one way to disarm individuals is by speaking to it, talking through maybe what it is that has you concerned or has you thinking that the individual might be experiencing food insecurity. So being able to maybe talk to maybe the warnings, the indicators that you are aware of, maybe that they've skipped a meal, or that they're not eating when other people are eating, or maybe different behaviors that you have. I think when you speak to it, it helps to disarm that conversation. And I think that sometimes that lowers that anxiety that you may have regarding being able to initiate that conversation. So just always going forward with that compassionate, caring mindset sometimes can make that conversation much smoother. And so for the sake of time, I do want to just reiterate the resources that we have on campus, as Karen has done a great job of articulating some of those resources that are out in the community. But at the Health Science Center, we do have 2 food pantries. One is at the Student Service Center. It is on the first floor, and that one is open Monday through Friday, 8 to 5, as long as campus is open. And so you can come in anytime and utilize the food pantry. It is anonymous, so you don't have to worry about putting your name down. We just ask that you will write down how much food that you are taking. There is a scale that you can use to weigh the food and just track how much food you are taking. The other location is at the library, and it is open as long as the library is open. So it's not necessarily 24/7, but as long as the library is open, then you have access to that food pantry there. And if you have any questions, you can reach out to myself, jeremy.joseph@unthsc.edu, or reach out to sark@unthsc.edu. And then I will say that, again, just thank you to Karen for coming out and participating. And if you have any additional questions, anything that sparks your mind after the presentation today, don't hesitate to reach out, and we can get you plugged into resources, we can get you plugged into support, and answer any questions that you do have.
Yes, so thank you both, Karen and Jeremy, for joining us today. And we also want to thank all of our participants for joining us. We appreciate you taking time out of your schedule. And we also wanted to share that all students attending today will be entered into win, a Yeti coffee mug, and the winner will be contacted via their HSC email. So please keep a lookout for that. And also, if you are near campus or on campus today, please join us for our resource fair. It's going to be from 4 to 6 o'clock in the Met 109, 111. I'm going to post the link so that you can see some of our upcoming events. And yes, again, just thank you guys for joining us.